Hello, I'm Dr. Asha Vahabzadeh, and I'm here at the Digital Health and Fitness Live studio by United Healthcare. And I'm joined by Jeff McCloud, who's a senior digital product designer by Ximedica.
Hello.
Nice to meet you, Jeff.
Nice to meet you as well.
And you're doing something super interesting. Can you tell us a little bit about what you're doing?
Sure, we're really trying to promote a vision of using zero UI for clinicians in the OR and be able to age in place. So really what that means is being able to eliminate the screen. So there's a lot of screen time for the physicians, for people at home with children. They're constantly on your phones, and there's a big distraction between that. So we really want to actually use haptics or gestures or voice interfaces to be able to interact with technology and be able to be empathetic to the actual user and be able to have them interact with their healthcare record and monitor them when they're aging in place or when they're in the OR with complex surgical equipment.
That's great, because screen time is such a big complaint for physicians who have to spend so much of their time looking at screens, and for patients who feel their physicians aren't looking at them and interacting with them. So how have people responded to this type of technology?
So it's really natural, because we have people like my grandmother who's 93, and so she doesn't really have the capacity to have a new technology and have to learn a new device or whatever, but she has an Amazon Echo to be able to age in place and be able to control lights, turn them on and turn them off, and we can apply that to, on a greater scale, have your connected care and be able to have medication adherence and be able to remind the people and be like, oh, I've already taken my meds today, and respond back to the clinician, and be able to have a care plan to be able to have access to the physician at home rather than going to a clinic.
So you mentioned the Amazon Echo. Is that the kind of principal focus, or are there other devices that you're kind of looking at? What does the kind of physical element look like at the moment?
Sure. So Amazon Echo is just one of the zero UI devices. There's also Google Nest and other ones that have various different products. A lot of them are coming out in CES this year. So not just that physical part of that, they can be embedded into other systems like complex surgical equipment, robotic systems. So you have a lot of this opportunity to have just that interface that doesn't have a screen component with it. So you don't have to have something else in the home, you don't have to have something else in the OR, you don't have to have something else in the clinic.
So that's super exciting. It sounds like there's an entire branch of technologies that are going to be emerging that you can use for this zero UI interface.
Right.
Is there a take-home that you would tell people from your talk today, if someone didn't get a chance to be here in person, and you want to give them a single take-home?
Sure. It's critical to understand what the user really cares about and be empathetic to them, and really kind of get the lifestyle component, the peace of mind components, and being able to actually leverage those rather than just applying technology because it gets you a headline.
Wonderful. So understand the user.
Understand the user, yes.
Jeff, thank you so much for your time.
Thank you very much.
Thank you.
Bye.
I'm Dr. Asha Vahabzadeh, and I'm reporting from the Digital Health and Fitness Live studio by United Healthcare. Thank you so much.